about the delays. And thank you for having me. And basically my job here today is to tell you what you have been doing in the last few years, developing the UPC Adapt, and possibly, and in the future using it, is such a great thing for prevention, personally I think for Europe, but certainly this is what I can say of significance at the global level. And to do so, I need to take a bit of a roundabout way, so please bear with me if I don't look like I'm getting straight to the point. I'm getting there, I promise, and not too much time. So, a few years back, like 7, 8 years ago, as I told you, it's not a history lecture. We're not going back at the beginning of time. We started to work a bit more systematically about promoting evidence-based prevention. And at that point, really, the situation that we were finding when we were talking with policymakers around the world was that there was a generally a very low understanding of the theology of the factors that really make people vulnerable to start and to develop drug use disorder or substance use disorder. No real understanding of what really works. And that was leading to a lot of stigma, of discrimination, ineffective and even harmful practices. And this is why we, in 2013, we started thinking about the standards. At that point, the EMCDDA was already working with the European group on the quality standard. And we wanted to build on that by providing just a summary of what works and what doesn't work to start this discussion all around the world. And we published the first edition in 2013. You might know this year we have published together with the WHO an updated version. It's very, very similar. It's just we have updated the references with the most recent ones. And then we started using it, and we have been going around the world in more than 60 countries, and we were talking with a lot of policymakers. Mostly we were having seminars of 2 or 3 days. And what we were trying to do was really to have this dialogue about what is going on in your prevention and how does it compare to the standards, how can we improve it a bit. And try to understand that prevention is really linked to the development of children, is much less linked to the campaigns. I mean, there is a role for that, but we're really talking about helping children develop healthy. What is effective, the value of investing, because it takes time and money in what is effective. What we found as a good side effect was often coordination. In many countries, it was the first time that people were together. I mean, of course, they knew each other, right? People from the Ministry of Education, law enforcement, drugs, health. But there had never been that space where they could sit down and really think together about prevention. Each one was just working on their mandates. They were maybe talking to each other for small things, but not collectively thinking together to improve prevention. We were not that able to have a good dialogue on the quality of prevention and how to support the system. This is something that we really still need to work a lot about. And I'm hoping that this kind of initiatives really help. And so, of course, we were looking into changing knowledge and attitudes, but also more evidence-based activities and more long-term investment. And the idea of developing a workforce, a professional preventologist was there, but a bit bare in the background. It was not strong. It was not very clear. And so, okay, so you can imagine we've been, working with all of these policymakers. We try to document our work. So yes, there is a change in knowledge. Before and after the meetings, the policymakers give less wrong answers and better right answers, which we are happy about. We also try to track the impact of this on the decision-making process at the global level. So the policymakers we are working with are often the ones that come to Vienna at the Commission to do the resolutions and make decisions about how collectively all member states should address the drug problem. And so 2013, it was the launch of the standards, and you can see the dark line is the number of resolution calling for evidence-based prevention, and the light gray is the number of resolution calling from no evidence-based prevention. Sorry, not number of resolution, but number of times within the resolution these are called for. And thanks to Hannah, who actually did this analysis for us when she was in our office. And so, of course, we are not the only one who, moved the dialogue forward, but we do think we did do a lot of advocacy within the Commission, and we do think we did have a little bit of influence in making sure that member states really see prevention more importantly and evidence-based prevention within that. And, but I also want to give you some examples of the practical impact that we had, just because this will bring us back to what you are doing now. So at a certain point, I received a call from my colleagues in Nigeria. They are fortunate, they have quite a big program that they can implement. And they say, the government would like to do such a very nice big media campaign. And so can you help us? And I say, yes, I can help you, but maybe I also have other ideas. So I explained to them, and we did a seminar. And I think that the seminar in that particular case was really instrumental to moving the policymakers to think, well, maybe we can also, the media campaign is still there, also pilot evidence-based program and really try to do this a bit more systematically, a bit more scientifically. And so we convinced them to pilot Unplugged, and Per has been very, very involved, and his team, and also the team of Federica in the evaluation have been involved in helping UNODC to reach more than 50,000 students. It sounds impressive, but of course we're talking about Nigeria. It's like still a drop in the ocean, right? But it has been successfully adapted to the local situation. We needed, the materials a bit different, more training for the teachers because they were not used to interactive techniques. The results have been presented in USPR, and now we're looking into fidelity tools because this thing is now alive and it's replicating itself around Nigeria, and would really like to document its work as much as we can. We also convinced the Nigerian government to try out strengthening families programs, and that was more difficult. It's still in a pilot phase. We went through the Ministry of Education, but for many reasons it was not the right home for that program. And there were technological challenges around the use of the videos in areas, anything that is not the rich center of the capital, essentially. So that is working, but it really started us thinking, there are things that we need to think about going to scale. While, for example, when we were doing family-based in Central Asia and Central America, also following the seminar for policymakers, it went much more smoothly. It took us more time to convince the relevant ministries. In Panama, we started with NGOs, and the ministry came in only after. But eventually, it did get adopted by at least 1, 2, 3 countries as part of their program. Now, I still want to see what happens in reality, but it was a very, very encouraging sign. So what we had there were like structures that were not really ready to get some of the programs, and programs that had some problems in being delivered in low resource settings. So for the last one, we have trying to contribute. For example, we are developing new family-based programs that are light and in the public domain, much as Unplugged has done for school-based prevention. You know, it was the first program that was the lightest and the one in the public domain after many, many beautiful but big, expensive copyrighted programs. So we wanted to do something similar for families. But then the problem of the structures remain. Huh? And so, and if you think about it, I mean, we should have thought about it before, because what we do is either we work at that higher level, at the federal level of the policymakers, and we try to convince them, look, you really, really need to do evidence-based prevention. It's really, really, really a good idea. And, or we work directly at the facilitators level. So the people that are working with the parents, the teachers that are working with the students, we train them to deliver that program. But we have never been really working in the middle. And we have always been relying on existing structures. And in some cases, we have been lucky. There has been a structure. There has been a structure that is ready. In other cases, we have not. And this is where UPC comes in. And this is where I said that, you know, our idea that we should have developed the workforce was here, but it was not very developed. Well, now it's being developed by you guys, and this is great because it's really filling a very important gap in the prevention system. And the good thing is that the entire thing is connected, right? So the UPC, developed by Zili and her group, is really based on the standards, takes the standards, at least in the introduction, and goes in much more depth. And then, of course, this group has taken the curriculum, the coordinator series, and adapted it and streamlined it for European purposes, which is also, which is really incredible. And we need it, okay? We really, really need it. Look at this. So the commitment to improve drug prevention and treatment, but here we are mostly you know, thinking about prevention, is there. I have never had stronger mandates from my member states. I've never had the member states saying, yes, we really, really want to do prevention like I have now. In the Sustainable Development Goals, we have one target that is only about substance use prevention and treatment, 3.5. There is a very strong goal about reducing the impact of non-communicable disease, which is also relevant for us. We know that when we do good prevention, we are also contributing to eliminating violence against children, particularly family-based prevention, and I can document very good contribution also in reducing poverty, gender equality, and inequalities in general. So there are many very good reasons under which we can justify, you know, strengthening prevention. And of course, in 2016, we had a special session of the General Assembly of the United Nations. They agreed on a new approach to dealing with drugs, which is based on public health, on scientific evidence and human rights, and prevention is one of the most important pillars there. But the situation is a bit different, right? So in treatment, I can at least say the situation in treatment is abysmal. Only 1 person in 6 that needs treatment is actually in treatment. In prevention, I cannot even say that. And I know there are reasons, and you know, and the MCDDA has done a lot of efforts to document at least the different kind of preventions, like the presentation that you did to the USPR, Gregor. But it does tell something that we don't have even a vague idea of coverage that we can quote. I mean, I have my ideas, but not, you know, a proper systematic study. And as for treatment, we know that the quality of the treatment that is available is often questionable, and there are loads of question marks. I think that the same is with prevention. Although, again, you know, we have, I think, only our collective wisdom and not scientific evidence out on that. Although I have some terrible data Every year, the member states report to us about what they do. They get asked, do you do these kind of things in prevention? Yes, no. What is your coverage? Very high, so that's why I'm not presenting this thing to you. How much do you evaluate? The maximum is 8%. And please note that this is less than half of the member states in the world that are reporting to this. So, and this is a rosy picture, so you can imagine what is the reality, right? So there is really, really a lot of work to do, and often in our world, we are always saying we need more resources, which is very, very true. But let's think that we can express a wish, right? And I get all of the money that I need now to achieve 100% coverage in evidence-based programs that I really, really think have been proven efficacy. Yes, efficacy, because not all have effectiveness being proven. Where are the men and the women that would deliver this program, that would manage these programs? We don't have them. We would need to express another wish, if we have it, available to get more money to train, but it will still take us a long, long time. And this is why I'm reliably informed that the genies do not exist, and we cannot express these wishes, but this is why what you have been doing is so, so relevant. And why I'm very grateful to be here with you in these couple of days. I think it's a great opportunity to celebrate amazing work and to plot our next move, because I think that there are still a lot of questions that we need to think about. We have this new amazing tool. How do we use it, right? How do we promote the development of the workplace in prevention in the best possible way? Prevention is scattered. Maybe it's not so much of a concern here in Europe, but in many, many countries it's still very much dominated by law enforcement. This is something that I have to face very, very often. Should we promote a choice? Should we promote that prevention is part of health, of education, social welfare? Should we create this new profession instead of like the preventologist, instead of embedding prevention in all older professions like doctors, nurses, social workers? And even if we have, I mean, I don't think we need to decide, but I think we need to think about that and think about our strategy and how to go about this. And how do we move this forward? Of course, the example of the Czech Republic that has quality standards that require people that deliver prevention to have been certified is a shining example at the global level, actually. But maybe there are other ways that we can think about together. So, as I said, I'm very, very interested. I'm very happy to celebrate, but I'm interested in the discussions that we will be having here. And so here's to you all and to our next move. Thank you very much.